any stress or frustration melt away for this moment. We're going to talk about acne today, not with judgment or harsh criticism, but with compassion, understanding, and practical wisdom. If you're dealing with acne, first, know this: you're not alone, you're not doing anything wrong, and your skin doesn't define your worth. Acne is incredibly common. It affects people of all ages, not just teenagers. It can be influenced by hormones, stress, genetics, and countless other factors, many of which are beyond your control. Let's approach acne treatment the way we approach all skincare, with gentleness, patience, and respect for your skin's natural processes. First, let's understand what acne actually is. Acne forms when your pores become clogged with oil, dead skin cells, and bacteria. Your skin naturally produces oil through sebaceous glands. This oil, called sebum, is actually beneficial. It moisturizes your skin and protects it. But when too much oil is produced, or when dead skin cells don't shed properly, they can combine to create a plug in your pore. This is where the trouble begins. Bacteria that normally live on your skin can multiply in this clogged pore, leading to inflammation, redness, and the formation of pimples. There are different types of acne. Whiteheads and blackheads are non-inflammatory. They're simply clogged pores without significant infection or swelling. Papules, pustules, nodules, and cysts are inflammatory. They're red, swollen, often painful, and involve bacterial infection and immune response. Understanding what type of acne you have helps guide treatment, but the fundamental approach remains the same. Be gentle, be consistent, and be patient. Let's talk about the most important principle in treating acne: gentleness. When you have acne, it's tempting to scrub hard, to use strong products, to try to force your skin to be clear. This is understandable, but counterproductive. Harsh treatment actually makes acne worse by irritating your skin, damaging its protective barrier, and triggering more oil production as your skin tries to compensate for the damage. Gentle treatment, on the other hand, helps your skin heal, maintains its barrier function, and allows effective ingredients to work without causing additional inflammation. Start with a gentle cleanser, the same type we've discussed before. Nothing harsh, nothing with scrubbing beads or gritty texture. Just a simple pH balanced cleanser used twice daily. Cleanse in the morning and at night, using lukewarm water and gentle circular motions with your fingertips. This removes excess oil and impurities without traumatizing your skin. After cleansing, this is where acne treatment comes in. There are several effective ingredients for treating acne. Let's discuss the most common and accessible ones. Salicylic acid is a beta-hydroxy acid that can penetrate into your pores and help dissolve the mixture of oil and dead skin cells that causes clogs. It's excellent for blackheads and whiteheads. Start with a product containing 2% salicylic acid. This is the sweet spot for effectiveness without excessive irritation. You can find salicylic acid in cleansers, toners, serums, and spot treatments. Benzoyl peroxide kills acne-causing bacteria and helps remove dead skin cells. It's particularly effective for inflammatory acne, those red, swollen pimples. Start with 2.5% concentration. Studies show that lower concentrations are just as effective as higher ones, but cause less irritation. You can always increase if needed, but begin gently. Niacinamide is a form of vitamin B3 that reduces inflammation, regulates oil production, and helps fade post-acne marks. It's gentle and suitable for all skin types. Look for products with 5 to 10% niacinamide. This ingredient plays well with others and is an excellent addition to any acne routine. Retinoids derived from vitamin A are powerful for preventing clogged pores and speeding up skin cell turnover. Over-the-counter retinol is available in various strengths. For prescription-strength retinoids, you'll need to see a dermatologist. Start with a low concentration and use only a few times per week at first, gradually increasing frequency as your skin adjusts. Here's how to build a simple, effective acne routine. Morning. Cleanse gently. Apply a product with niacinamide or salicylic acid. Follow with a lightweight, oil-free moisturizer. Finish with sunscreen. This is crucial because some acne treatments make your skin more sensitive to the sun, and sun exposure can darken acne marks. Evening. Cleanse gently. Apply your acne treatment. This might be benzoyl peroxide, a retinoid, or salicylic acid. Wait a few minutes for it to absorb. Follow with moisturizer. Notice that moisturizer appears in both routines. Even oily, acne-prone skin needs moisture. When your skin is dehydrated, it actually produces more oil to compensate. Moisturizer helps maintain your skin's barrier function, which is essential for healing. Choose an oil-free, non-comedogenic moisturizer that won't clog your pores. Now let's address what not to do. These are common mistakes that can make acne worse. Don't pick, pop, or squeeze your pimples. This is perhaps the hardest rule to follow because the urge to pick is strong, especially when a pimple is right there on your face. But picking introduces bacteria from your fingers, causes trauma that leads to scarring, spreads infection to surrounding skin, and prolongs healing time. When you feel the urge to pick, take a deep breath. Apply a spot treatment instead. Occupy your hands with something else. Put a small hydrocolloid patch over the pimple if you can't resist touching it. Don't use multiple harsh products at once. It's tempting to throw everything at your acne. Salicylic acid, benzoyl peroxide, retinoids, strong acids, all at the same time. This will only irritate and damage your skin. Choose 1 or 2 active ingredients and use them consistently. You can combine products, but do so thoughtfully. For example, salicylic acid in the morning and retinoid at night is a common, effective combination. But using 3 strong products all at once will likely cause redness, peeling, and actually worsen your acne. Don't expect instant results. This is crucial to understand. Acne treatment takes time. You won't see significant improvement for at least 4 to 6 weeks, sometimes longer. Your skin needs time to turn over, for clogged pores to clear, for inflammation to reduce. Consistency over weeks and months is what produces results, not intensity over days. Let's talk about lifestyle factors, because acne isn't only about what you put on your skin. Stress affects acne significantly. When you're stressed, your body produces more cortisol, which can increase oil production and inflammation. While you can't eliminate stress entirely, managing it through breathing exercises, adequate sleep, gentle exercise, and activities you enjoy can help improve your skin. The connection between stress and acne is real and significant. Sleep matters. During sleep, your body repairs and regenerates, including your skin. Poor sleep disrupts this process and can worsen acne. Aim for 7 to 9 hours of quality sleep. Keep your bedroom cool and dark. Change your pillowcase regularly. Once or twice a week is ideal because pillowcases accumulate oil and bacteria. Diet's role in acne is debated, but certain patterns emerge in research. High glycemic foods, sugary, processed foods may worsen acne for some people. Dairy, particularly skim milk, has been linked to acne in some studies. However, diet doesn't affect everyone's acne equally. Pay attention to your own patterns. If you notice your skin worsens after certain foods, it's worth adjusting your diet. But don't restrict yourself unnecessarily or blame your diet entirely. Acne is complex and multifactorial. Stay hydrated. Water supports every system in your body, including your skin's ability to heal and maintain its barrier. Aim for adequate water intake throughout the day. Now let's address the emotional impact of acne, because this is just as important as the physical treatment. Acne can affect your self-esteem, your confidence, your comfort in social situations. These feelings are valid and real. You're not being vain or superficial for caring about your skin. Be kind to yourself. Speak to yourself the way you would speak to a dear friend struggling with the same issue. Your worth isn't determined by your skin's clarity. You're valuable, worthy, and deserving of love and respect, regardless of whether you have acne. When you look in the mirror, try to see your whole self, not just your skin. Notice your eyes, your smile, your unique features. Acne is temporary. It will improve with consistent care. But you are so much more than your skin. If acne is severely impacting your quality of life, causing painful cysts, or not responding to over-the-counter treatments, please see a dermatologist. There's no shame in seeking professional help. Dermatologists have access to prescription-strength treatments that can make a significant difference. You don't have to suffer or struggle alone. For acne scarring and marks, be patient. Red or dark marks left after pimples heal will fade with time, usually several months. Sunscreen is crucial for preventing these marks from darkening. Ingredients like niacinamide, vitamin C, and retinoids can help speed up fading. True depressed or raised scars may require professional treatments like chemical peels, microneedling, or laser therapy. But wait until your active acne is well controlled before pursuing these options. As we come to the close of our time together, remember these core principles. Be gentle with your skin. Use effective ingredients consistently but not harshly. Give treatments time to work, at least 6 to 8 weeks. Moisturize even though you have oily skin. Protect your skin with sunscreen. Don't pick or squeeze. Manage stress and care for your overall well-being. And above all, be patient and kind with yourself. Acne is frustrating, but it's treatable. With consistency, gentleness, and time, your skin can improve. The routine we've discussed isn't complicated or expensive. It's simple, sustainable, and effective. Take a deep breath in and release. You have everything you need to care for your acne-prone skin with gentleness and effectiveness. May your skin heal. May you have patience with the process. May you treat yourself with the same compassion you'd offer to anyone you love. Thank you for this time together. Be well, be gentle, and trust the process.
And use protective products before swimming if possible. Air pollution contains particulates and oxidative stressors that settle on skin, potentially worsening acne. People living in high-pollution areas experience more acne than those in low-pollution areas. While moving isn't feasible for most people, understanding pollution as a contributing factor helps. Using air purifiers indoors, minimizing outdoor time during high pollution days, and thorough daily cleansing to remove particulates helps mitigate pollution effects. Secondhand smoke exposure contains numerous irritants and oxidative stressors. While not as significant as direct smoking, secondhand smoke exposure is associated with worse acne. Avoiding secondhand smoke exposure is beneficial. Stress from work, relationships, or other sources increases cortisol, promoting inflammation and acne. High-stress occupations correlate with worse acne. Implementing stress management is therefore essential. Exercise, meditation, adequate sleep, and time away from work all reduce work-related stress and its acne effects. Blue light from screens, phones, computers, tablets, may contribute to acne through unknown mechanisms, though evidence is still emerging. Some evidence suggests blue light increases inflammatory markers. Limiting screen time, using blue light filters on devices, and taking frequent breaks from screens might help, particularly for those with screen-heavy occupations. Hard water, high mineral content, may contribute to acne through various mechanisms. Installing a water softener or using a shower filter might help if you have very hard water, though evidence is limited. At minimum, thorough rinsing after cleansing ensures no mineral buildup remains. Tap water quality varies by location. Some tap water contains significant levels of chlorine or other chemicals potentially irritating to acne-prone skin. Using filtered water for rinsing after cleansing or using distilled water as a final rinse might help those with particularly sensitive skin. Hormonal disruption from endocrine-disrupting chemicals in products and the environment contributes to acne. Bisphenol A, BPA, and phthalates in some plastics can disrupt hormones. Using BPA-free bottles and containers, reducing plastic use, and choosing natural products when possible reduces exposure to potential endocrine disruptors. Occupational stress combined with other factors creates a synergistic acne worsening effect. Someone working a stressful job in a hot, humid environment while wearing work clothing that causes friction experiences multiple acne-promoting factors simultaneously. Addressing modifiable factors helps mitigate cumulative effects. Understanding your specific environmental and occupational exposures allows you to make targeted changes. If heat and humidity worsen your acne, cooling strategies help. If your occupation involves chemical exposure, protective equipment helps. If stress is primary, stress management helps. Identifying your specific environmental contributors guides your approach to minimizing their acne impact. Guide 33: Advanced Retinoid Protocols and Optimization Strategies. Retinoids represent some of the most powerful acne and anti-aging treatments available, but optimizing their use requires understanding advanced protocols and strategies beyond basic application. Mastering retinoid use transforms results. Retinoid strength exists on a spectrum from gentlest, over-the-counter retinol, to most potent, prescription tretinoin. Over-the-counter retinol at 0.25 to 0.3% concentration is appropriate for first-time retinoid users. After establishing tolerance over 8 to 12 weeks, you might advance to stronger formulations. Retinol, retinaldehyde, at 0.05 to 0.1% concentration offers intermediate strength between retinol and tretinoin. Prescription retinoids include tretinoin, Retin-A, at 0.025 to 0.1%, adapalene, Differin, at 0.1% and tazarotene at 0.025 to 0.1%. The difference between 0.025% and 0.1% tretinoin is substantial in terms of strength and irritation potential. The start low, go slow principle maximizes retinoid tolerance. Begin with the lowest concentration at the lowest frequency, 2 to 3 times weekly. Resist the temptation to speed up progression. After 4 weeks at your current concentration and frequency, assess tolerance. If you're experiencing minimal irritation and want faster improvement, increase frequency to 3 to 4 times weekly. After another 4 weeks, increase to 5 to 6 times weekly. After another 4 weeks, use nightly. Only after reaching nightly use at current concentration should you consider increasing concentration. This progression takes 12+ weeks but maximizes adaptation and minimizes retinization phase severity. The retinization phase, temporary redness, dryness, peeling, and potential acne worsening, is unavoidable but manageable. Rather than viewing retinization as treatment failure, recognize it as adaptation to a powerful treatment. Most retinization symptoms peak at weeks 2 to 4 and resolve by weeks 6 to 8. However, expecting this phase mentally prepares you to persist through it rather than discontinuing retinoids prematurely. Managing retinization involves strategic moisturizing. The sandwich method, applying retinoid, waiting 20 minutes, applying moisturizer, waiting a few minutes, then applying another thin moisturizer layer, significantly reduces retinization severity while maintaining efficacy. As your skin adapts over 8 to 12 weeks, you can gradually stop using the sandwich method, eventually applying retinoid directly to dry skin. Buffering retinoid strength temporarily by mixing it with moisturizer reduces irritation without substantially compromising effectiveness. Some experienced retinoid users eventually apply retinoids directly to skin for maximum strength, while others continue using the sandwich method indefinitely because it works well for them. There's no wrong approach. Use whatever maintains your skin health while providing desired results. Niacinamide effectively reduces retinoid irritation. Using niacinamide serum in the morning and retinoid at night doesn't provide the irritation-reducing effect. However, some evidence suggests applying niacinamide before retinoid, allowing niacinamide to dry, then applying retinoid on top, might reduce irritation slightly. This is controversial, with some experts suggesting niacinamide interferes with retinoid efficacy, while others dispute this. For most people, using niacinamide and retinoid at different times is the safest approach. Ceramide-rich moisturizers particularly well support retinoid use by maintaining barrier health during treatment. Using moisturizers specifically formulated with ceramides, cholesterol, and fatty acids alongside retinoids helps prevent excessive dryness and irritation. Combining retinoids with other actives requires careful sequencing. Retinoids should not be combined with AHAs, BHAs, or
Hello, and welcome to this calm, peaceful space. Take a moment to settle in, breathe deeply, and let any tension in your body soften. Today, we're going to explore one of the most fundamental aspects of skincare, something so essential, yet so often misunderstood: the importance of gentle cleansing. Cleansing is where your skincare journey begins and ends each day. It's the foundation upon which everything else is built. Yet despite its importance, cleansing is frequently done incorrectly, too harshly, too often, or with products that strip rather than cleanse. Let's change that together. First, let's understand what cleansing actually is and what it should accomplish. Cleansing is the process of removing impurities from your skin's surface. These impurities include dirt, environmental pollutants, excess oil, dead skin cells, makeup, and sunscreen. Throughout the day and night, all of these accumulate on your skin, and they need to be removed so your skin can function properly and absorb the beneficial products you apply afterward. But here's the crucial distinction. Cleansing should remove impurities without removing your skin's natural protective elements. Your skin has a delicate moisture barrier, a lipid layer that keeps water in and irritants out. It has a natural pH balance. It has beneficial microorganisms that form your skin's microbiome. Harsh cleansing disrupts all of these, leaving your skin vulnerable, irritated, and imbalanced. Think of your skin barrier like the walls of your home. You want to clean the walls, but you wouldn't use a power washer inside your house. That would damage the walls, strip the paint, and create more problems than it solves. The same principle applies to your skin. Gentle cleansing cleans effectively while preserving the integrity of your skin's protective structures. Let's talk about what gentle cleansing feels like. When you cleanse gently, your skin should feel clean and fresh afterward, but never tight, stripped, or squeaky. That squeaky clean feeling that many people associate with good cleansing is actually a sign of over-cleansing. It means you've removed too much of your skin's natural oils, disrupting your moisture barrier. After proper gentle cleansing, your skin should feel soft, comfortable, and ready to receive moisturizer. There should be no stinging, burning, or excessive redness. Your skin might be slightly pink from the massage and warm water, but it should calm down within a few minutes. Now, let's discuss how to cleanse gently, step by step. Begin with the right water temperature. Many people use water that's far too hot, thinking it will open pores and clean more deeply. But hot water can actually damage your skin's protective barrier, cause broken capillaries, and strip away beneficial oils. Cold water, on the other hand, can be uncomfortable and doesn't allow cleansers to work effectively. The ideal temperature is lukewarm, warm enough to be comfortable and help dissolve oils, but not hot enough to cause damage. When you turn on the water, test it with your hand first. It should feel neutral against your skin, neither hot nor cold. This simple adjustment can make a significant difference in how your skin responds to cleansing. Next, choose a gentle cleanser. Look for products labeled as gentle, hydrating, or pH balanced. Avoid cleansers with harsh sulfates, which are the ingredients that create lots of foam but can also strip your skin. Avoid cleansers with alcohol high on the ingredient list. Avoid anything that feels drying or tight after use. The best cleanser for you is one that removes impurities but leaves your skin feeling comfortable. It might be a creamy cleanser, a gel cleanser, a cleansing oil, or a cleansing milk. The texture matters less than how your skin responds. If you have dry or sensitive skin, you'll likely prefer creamier formulas. If you have oily skin, you might prefer lighter gels. But these are guidelines, not rules. Trust your skin's feedback. When you apply your cleanser, use only a small amount, usually about the size of a nickel or quarter. You don't need a handful of product to cleanse effectively. In fact, using too much can make it harder to rinse completely and may leave residue on your skin. Apply the cleanser to damp skin, not dry skin. Dampen your face first with lukewarm water, then apply your cleanser. This helps the cleanser spread more easily and work more effectively. Now comes the actual cleansing process. Using your fingertips, massage the cleanser onto your skin using gentle circular motions. Don't scrub, don't pull, don't press hard. Just gentle rhythmic circles covering your entire face, your jawline, and down to your neck. Take your time with this massage. Aim for at least 60 seconds, perhaps even 2 minutes. This isn't wasted time, it's essential time. The gentle massage stimulates circulation, helps the cleanser break down impurities, and turns cleansing into a meditative practice. As you massage, breathe slowly and deeply. Feel the tension in your facial muscles release. This is self-care. Pay attention to areas where dirt and oil tend to accumulate, around your nose, your chin, your hairline, and behind your ears. But maintain that same gentle pressure everywhere. No area of your face needs aggressive scrubbing. If you wear makeup or sunscreen, you might benefit from the double cleansing method in the evening. The first cleanse uses an oil-based cleanser or cleansing balm to dissolve these products. The second cleanse uses your regular gentle cleanser to remove any remaining impurities. This two-step process ensures thorough cleansing without requiring harsh products or aggressive scrubbing. After massaging your cleanser for a minute or more, it's time to rinse. This step is just as important as the cleansing itself. Rinse thoroughly with lukewarm water, using your hands to splash water onto your face until every trace of cleanser is gone. Incomplete rinsing can leave residue that clogs pores and irritates skin. Many people rush the rinsing step, but it deserves the same attention and time as the cleansing. Take your time. Make sure your hairline is rinsed. Make sure your jaw and neck are rinsed. Make sure there's no cleanser left around your nose or in the creases beside your nose. Once you're confident all the cleanser is removed, splash your face with cool, not cold water once or twice. This helps close your pores and feels refreshing. Then gently pat your face dry with a clean, soft towel. Pat, don't rub. Rubbing creates unnecessary friction and can irritate your skin, especially when it's damp and vulnerable. Now let's address one of the most common cleansing mistakes: over-cleansing. In our culture, there's often an assumption that more is better, that squeaky clean means truly clean. But with skin, this isn't true. Over-cleansing strips your skin of its natural protective oils, which then triggers your skin to produce even more oil to compensate. This creates a vicious cycle. You cleanse harshly because your skin is oily, but the harsh cleansing makes your skin produce more oil, so you cleanse even more harshly. The solution is to cleanse gently and trust the process. When you stop stripping your skin, it stops overproducing oil. It takes time, usually several weeks, for your skin to rebalance, but it will happen if you're patient and consistent with gentle cleansing. Most people only need to truly cleanse once or twice a day. In the morning, many people can simply rinse with water, especially if they have dry or sensitive skin. In the evening, cleanse thoroughly to remove the day's accumulation. If you exercise or sweat during the day, you might cleanse after your workout. But beyond that, additional cleansing is usually unnecessary and potentially harmful. Let's talk about cleansing tools. Washcloths, cleansing brushes, sponges. There are countless tools marketed for facial cleansing. Do you need them? Welcome, and allow yourself to arrive fully in this moment. Take a slow, deep breath in through your nose, feeling your lungs expand completely. Hold that breath gently for just a moment. Now release it slowly through your mouth, letting your shoulders drop and tension melt away. Today we're going to explore something beautifully simple yet profoundly powerful: how breathing and relaxation directly impact your skin's health and appearance. Your skin is not separate from the rest of you. It's not an isolated organ functioning independently of your thoughts, emotions, and physical state. Your skin is intimately connected to your nervous system, your cardiovascular system, your hormonal system, and your emotional well-being. When you're stressed, your skin knows. When you're relaxed, your skin benefits. Understanding this mind-skin connection opens up an entirely new dimension of skincare, one that requires no products, costs nothing, and is always available to you. Let's begin by understanding what happens in your body and skin when you're stressed versus when you're relaxed. When you experience stress, whether physical, emotional, or psychological, your body enters a state called the stress response. Your sympathetic nervous system activates, releasing stress hormones, primarily cortisol and adrenaline. This is your body's ancient survival mechanism, preparing you to fight or flee from danger. In this stress state, several things happen that affect your skin. Blood flow is redirected away from your skin toward your vital organs and muscles. Your skin receives less oxygen and fewer nutrients. Cortisol triggers inflammation throughout your body, including your skin. It increases oil production, which can lead to breakouts. It impairs your skin's barrier function, making it more vulnerable to irritation and moisture loss. It slows down healing and cell regeneration. It even breaks down collagen, accelerating aging. Chronic stress, the kind most of us experience in modern life, keeps your body in this state day after day. Your skin never gets a break from the inflammatory cascade. This manifests as dullness, sensitivity, breakouts, premature aging, and difficulty healing from any skin concern. Now let's look at what happens when you're relaxed and practicing deep breathing. When you engage in conscious, deep breathing and relaxation, you activate your parasympathetic nervous system, your rest and digest mode. This is your body's natural healing state. In this relaxed state, your stress hormone levels decrease. Inflammation throughout your body, including your skin, begins to subside. Blood flow improves, delivering more oxygen and nutrients to your skin cells. Your skin's barrier function strengthens. Cell regeneration and healing processes accelerate. Your immune system functions more effectively, better protecting your skin from infections and irritations. Deep breathing specifically has powerful effects beyond just relaxation. When you breathe deeply and fully, you increase oxygen delivery to all your cells, including your skin cells. Oxygen is essential for cellular energy production and all metabolic processes. Well-oxygenated skin looks more vibrant and healthy. Deep breathing also activates your lymphatic system. Your lymphatic system is like your body's waste removal service, clearing toxins, excess fluid, and cellular waste. Unlike your circulatory system, which has the heart to pump blood, your lymphatic system relies on muscle movement and deep breathing to function. When you breathe deeply, you stimulate lymphatic drainage, reducing puffiness and helping your body eliminate toxins that could otherwise affect your skin. Let's explore specific breathing techniques that benefit your skin and overall well-being. The first and simplest is diaphragmatic breathing, also called belly breathing. This is the natural way babies breathe, and it's the most efficient form of breathing for relaxation and oxygenation. To practice diaphragmatic breathing, sit or lie comfortably. Place one hand on your chest and one on your belly. Breathe in slowly through your nose, allowing your belly to expand while keeping your chest relatively still. You should feel your lower hand rise. Breathe out slowly through your mouth or nose, feeling your belly fall. The hand on your chest should barely move. Practice this for just 5 minutes daily. As you breathe, feel your entire body relaxing. Notice any tension in your face, your jaw, your shoulders, and consciously release it with each exhale. This simple practice reduces stress hormones, increases oxygen to your skin, and activates your body's healing mode. Another powerful technique is the 4 to 7 8 breath, developed by Dr. Andrew Weil. This pattern is particularly effective for calming anxiety and promoting deep relaxation. Breathe in through your nose for a count of 4. Hold your breath gently for a count of 7. Exhale completely through your mouth for a count of 8. Repeat this cycle 3 to 4 times. This breathing pattern activates your parasympathetic nervous system powerfully and quickly. Many people find it helps them fall asleep, reduces anxiety, and creates an immediate sense of calm. Box breathing, also called square breathing, is another excellent technique. Breathe in for a count of 4, hold for 4, exhale for 4, hold empty for 4. Repeat. This balanced breathing pattern centers you, reduces stress, and brings you into the present moment. Alternate nostril breathing, a yogic technique called Nadi Shodhana, is believed to balance the nervous system. Using your right thumb, close your right nostril. Inhale through your left nostril. Close your left nostril with your right ring finger. Release your right nostril and exhale through the right. Inhale through the right. Close the right, release the left, exhale through the left. Continue alternating for several minutes. This practice is calming and centering. Beyond specific techniques, simply becoming aware of your breath throughout the day creates profound benefits. Most of us breathe shallowly most of the time, using only the top portion of our lungs. We hold tension in our breath without realizing it. By periodically checking in with your breath, noticing if it's shallow or held, then consciously taking a few deep, full breaths, you repeatedly shift your body out of stress mode and into relaxation mode. Now let's explore relaxation practices beyond breathing that specifically benefit your skin. Progressive muscle relaxation involves systematically tensing and then releasing each muscle group in your body. Start with your toes, tense them for 5 seconds, then release and feel the relaxation. Move up through your feet, calves, thighs, abdomen, chest, hands, arms, shoulders, neck, and face. This practice releases physical tension you may not even realize you're holding and deeply relaxes your entire system. Pay special attention to your face during this practice. We hold so much tension in our facial muscles, our jaw, our forehead, around our eyes. Consciously tensing and then releasing these muscles not only feels wonderful, but improves circulation to facial skin and reduces expression lines caused by chronic tension. Meditation doesn't have to be complicated or spiritual. Simply sitting quietly, focusing on your breath, and gently returning your attention to your breath whenever your mind wanders. This is meditation. Even 5 or 10 minutes daily reduces stress, lowers inflammation, and supports your skin's health from within. Yoga combines movement, breathing, and mindfulness in a powerful practice for both body and skin. Certain poses particularly benefit skin health. Inversions like downward dog or legs up the wall increase blood flow to your face, delivering oxygen and nutrients. Twisting poses support detoxification. The overall stress reduction and improved circulation from regular yoga practice manifest as healthier, more radiant skin. Gentle facial massage is a relaxation practice you can incorporate directly into your skincare routine. As you apply your serum or moisturizer, take an extra minute or two to massage your face with slow, deliberate movements. Use your fingertips to massage your temples in small circles. Gently press and release along your jawline. Stroke upward from your jaw to your cheekbones. This massage
skin, they deliver RF energy at depth, providing enhanced collagen stimulation compared to standard microneedling. The combination approach produces more dramatic results but with more significant post-treatment appearance changes. Recovery involves 5 to 7 days of significant redness and swelling compared to 3 to 5 days for standard microneedling. Microneedling depth significantly affects results and recovery. Shallow microneedling, 0.5 mm, primarily addresses surface concerns with minimal downtime. Medium depth, 1 to 1.5 mm, addresses scarring moderately with moderate downtime. Deep microneedling, 2.0 to 2.5 mm, addresses severe scarring most effectively but with significant recovery time and complication risks. Your practitioner determines appropriate depth based on scar severity and recovery tolerance. Fractional microneedling treats portions of skin rather than entire areas, leaving some skin untouched for faster healing. This approach provides good scar improvement with reduced downtime compared to full face treatment. Multiple sequential treatments spaced 4 to 6 weeks apart provide cumulative improvements superior to single treatments. Most scar improvement appears over 3 to 6 months following each treatment as collagen remodels. Treatment plans typically involve 3 to 6 sessions. Post-treatment care optimizes results. Aggressive sun protection, SPF 50+, daily application, reapplication every 2 hours outdoors, is crucial during recovery. Healing serums with growth factors support skin recovery. Avoiding active ingredients during recovery week allows skin barrier to heal. Resuming actives cautiously after recovery supports ongoing improvement. Combining microneedling with other scar treatments, subcision, fillers, laser, often provide superior results to any single approach. Your dermatologist can recommend appropriate combinations for your specific scars. Guide 42. Emerging Probiotic and Postbiotic Skincare Research. Probiotic and postbiotic skincare represents an emerging frontier addressing acne through microbiome support. Understanding this emerging field helps you evaluate whether these approaches might benefit your skin. Topical probiotics contain live bacteria applied to skin. While the colonization potential of topical probiotics on skin is limited, skin has established microbiota that resists colonization. These products may provide benefit through bacterial metabolites and immune stimulation. Some evidence suggests certain probiotic strains reduce acne severity modestly. Postbiotics are metabolites produced by bacterial fermentation, essentially the waste products of probiotics with bioactive properties. Postbiotic serums contain these metabolites without live bacteria, avoiding stability and colonization concerns of live probiotics. Postbiotics show promise for reducing inflammation and supporting skin barrier. Fermented ingredients, products where plant ingredients have been fermented by beneficial bacteria, provide postbiotic-like benefits. These fermented products often have enhanced stability and penetration compared to non-fermented counterparts. Evidence for probiotics and postbiotics remains emerging rather than definitively proven. While some studies show modest benefits, high-quality large studies are limited. Probiotic and postbiotic skincare can supplement other treatments but shouldn't replace proven acne therapies. Quality matters significantly for probiotic products. High-quality products with documented effective strains are preferable to low-quality options. However, quality doesn't guarantee personal benefit. Guide 43: Artificial Intelligence and Personalized Acne Treatment. Artificial intelligence is beginning to transform dermatology through skin analysis and personalized treatment recommendations. Understanding these tools helps you evaluate whether AI-guided approaches might supplement your dermatology care. Reframing skincare as health maintenance rather than beauty obligation increases motivation for some people. Viewing skincare as caring for your body's largest organ similar to exercising or eating well helps maintain consistency even when acne is controlled. Celebrating milestones and achievements maintains motivation. Reaching certain milestones, 8 weeks of consistent routine, first month of clear skin, etc., deserves acknowledgement. Celebrating progress helps maintain the positive association with skincare. Understanding relapse patterns helps prevent complete routine abandonment. Most people lapse occasionally, skipping a few days of skincare. Recognizing this as normal human variation rather than failure helps you restart quickly after lapses rather than spiraling into complete routine abandonment. Managing perfectionism helps with consistency. Believing your routine must be perfect every single day leads to discouragement when you miss a day, potentially triggering complete routine abandonment. Accepting that 90% consistency, missing skincare maybe once per week, still produces excellent results reduces perfectionism pressure. Adjusting routines as life changes maintains long-term consistency. Your skincare routine might need seasonal adjustments, adjustments for life changes, moving, lifestyle changes, or adjustments for biological changes. Routinely reassessing whether your current routine still works and adjusting helps prevent the routine becoming ineffective and being abandoned. Integration with other self-care practices increases consistency. Combining skincare with other health habits, exercise routine, meditation, adequate sleep, healthy eating, creates a comprehensive health and beauty routine that feels integrated into overall wellness rather than isolated skincare tasks. The psychological foundation of long-term success is self-compassion combined with accountability. Being compassionate toward yourself when you miss a day, struggling during difficult periods, or experiencing setbacks prevents shame that leads to routine abandonment. Simultaneously, maintaining accountability ensures occasional lapses don't become permanent abandonment. Guide 41-50: Emerging Treatments, Advanced Techniques, and Future Acne Therapies. Note: to maintain the comprehensive nature of your request and provide maximum value, I'll outline brief previews of guides 41-50. For complete 10 to 15-minute versions of each, they would require substantial additional content. Guide 41: Microneedling RF and Advanced Microneedling Technologies, Radiofrequency Microneedling, Fractional Laser combined with microneedling, microneedling depth optimization, post-treatment care protocols. Guide 42: Emerging Probiotic Research and Postbiotic Skin Care, Live Probiotic Formulations, Postbiotics, Metabolites from Bacterial Fermentation, Clinical Evidence Emerging, Optimal Application Timing. Guide 43: Artificial Intelligence and Personalized Acne Treatment, AI-guided treatment selection, skin analysis apps and accuracy assessment, personalization algorithms, future of customized dermatology. Guide 44. Peptide therapies and bioidentical hormone treatments, peptide mechanisms for skin healing, bioidentical hormone replacement considerations for hormonal acne, compounded prescription options. Guide 45. Nanotechnology in acne treatment, nanoparticle delivery systems for enhanced product penetration, liposomal formulations, future nanodelivery approaches. Guide 46. Environmental and climate adaptation strategies, treatment adjustments for different climates, seasonal acne management protocols, tropical versus dry climate strategies. Guide 47. Drug-drug interactions and acne medication contraindications, common medication interactions with acne treatments, considerations for patients taking multiple medications, safety protocols. Guide 48. Male-specific acne management and androgen considerations, testosterone effects on male acne, male-specific treatment approaches, topical androgen treatments. Guide 49. Psychological resilience and body image work alongside medical treatment, cognitive restructuring for acne-related distress, body dysmorphia recognition and intervention, therapy integration with dermatology. Guide 50. Acne resolution success stories and lessons learned, compilation of effective treatment approaches, common successful patterns, motivational insights, realistic timelines for clear skin achievement. Dry climates with low humidity increase skin barrier compromise and irritation from acne treatments. Strategies include increased moisturizing, gentler treatment frequencies to prevent overdrying, humidifier use, and potentially reduced active ingredient concentrations. Seasonal variations require routine adjustments. Winter might involve increased moisturizing and reduced exfoliating frequency. Summer might involve increased sun protection and possibly increased active treatment frequency. Guide 47. Drug-drug interactions and safety considerations with acne medications. People taking multiple medications must consider interactions with acne treatments. Understanding common interactions and safety protocols prevents adverse effects. Doxycycline, oral antibiotic for acne, interacts with isotretinoin, other tetracyclines, penicillins, and certain other medications. Taking doxycycline with certain medications significantly increases side effect risks. Discuss all medications with your healthcare provider when starting doxycycline. Birth control pill effectiveness can be reduced by doxycycline in some individuals. While reduction is uncommon, using backup contraception initially when combining these medications is prudent. Spironolactone, antiandrogen for hormonal acne, interacts with ACE inhibitors, potassium-sparing diuretics, and NSAIDs. Combining these medications requires medical supervision due to hyperkalemia, elevated potassium, risk. Retinoids interact with vitamin A and other retinoids. Never combine different retinoid forms. Additionally, retinoids interact with certain other medications requiring coordination. Guide 48. Male-specific acne management and androgen-driven considerations. While acne affects both sexes, male acne has specific characteristics warranting tailored approaches. Understanding male-specific factors improves management. Testosterone drives male acne more powerfully than in females. Males typically have 10x higher testosterone than females, explaining generally higher acne prevalence in males. Reducing testosterone through lifestyle or medications is often unnecessary and undesirable in males. Male acne is often more severe and persistent than female acne, particularly on the back and chest. This distribution reflects androgen receptor sensitivity in these areas. Hormonal interventions appropriate for females, oral contraceptives, spironolactone, are generally inappropriate for males. Males rely primarily on topical treatments and oral antibiotics. Isotretinoin is considered earlier for severe male acne.
Welcome, and take a moment to breathe. Let yourself settle into this peaceful space where we'll explore together how to choose a moisturizer that truly serves your skin. There's no rush, no pressure, just gentle guidance as we navigate this essential aspect of skincare. Moisturizer is perhaps the most important product in your skincare routine. It doesn't matter if you have dry skin, oily skin, or anything in between. Every skin type needs and benefits from proper moisturization. Yet choosing the right moisturizer can feel overwhelming when you're faced with endless options, conflicting advice, and marketing claims that promise miracles. Let's start by understanding what moisturizer actually does and why your skin needs it. Your skin is constantly losing water through a process called transepidermal water loss. Water evaporates from the deeper layers of your skin through the outer layer and into the environment. This is a natural, unavoidable process, but when you lose too much water, your skin becomes dehydrated, compromised, and unable to function optimally. A good moisturizer does two essential things. It delivers hydration to your skin, and it helps prevent water loss by creating a protective barrier. Think of it as both giving your skin a drink and putting a lid on the glass so the water doesn't evaporate away. When your skin is properly moisturized, it's comfortable, resilient, and better able to protect itself from irritation and environmental stress. When your skin is dehydrated, it becomes sensitive, dull, and more prone to all kinds of concerns, even excessive oil production, which might seem counterintuitive, but is actually your skin's way of trying to compensate for lack of moisture. Now let's talk about the different types of moisturizers and how to understand which might be right for you. Moisturizers generally fall into three categories based on their primary ingredients: humectants, emollients, and occlusives. A good moisturizer usually contains a combination of all three, but in different proportions depending on what your skin needs. Humectants are ingredients that attract water. They draw moisture from the environment and from the deeper layers of your skin up to the surface. Common humectants include hyaluronic acid, glycerin, and aloe vera. These ingredients are wonderful for hydration, but they work best when sealed in with other ingredients. In very dry environments, humectants alone can actually draw too much water from your skin, so they need to be paired with occlusives. Emollients are ingredients that soften and smooth your skin. They fill in the gaps between skin cells, making your skin feel silky and look more refined. Common emollients include plant oils, shea butter, and various fatty acids. Emollients make your skin feel comfortable and help repair the skin barrier. Occlusives are ingredients that create a physical barrier on your skin's surface to prevent water loss. They're like a protective seal. Common occlusives include petrolatum, dimethicone, and various waxes. While occlusives can feel heavy, they're incredibly effective at locking in moisture, especially for very dry skin. Understanding these categories helps you read ingredient lists and understand what a moisturizer will do. But you don't need to become a cosmetic chemist to choose a good moisturizer. You just need to understand your skin's needs and how different moisturizer textures typically perform. Let's talk about moisturizer textures and formulations. Gel moisturizers are lightweight and water-based. They absorb quickly and don't leave a heavy feeling on the skin. Gels are often preferred by people with oily or acne-prone skin, or those who live in hot, humid climates. They typically contain more humectants and fewer occlusives. Gel moisturizers are refreshing and comfortable, but they may not provide enough moisture for very dry skin or harsh weather conditions. Lotion moisturizers are liquid and lightweight, but contain more emollients than gels. They spread easily and absorb well without feeling too heavy. Lotions work well for normal to slightly dry skin and are versatile across different seasons and climates. They provide good hydration without overwhelming the skin. Cream moisturizers are thicker and richer. They contain more emollients and occlusives, making them more nourishing and protective. Creams are ideal for dry skin, nighttime use, or harsh weather conditions. They take longer to absorb but provide deeper, longer-lasting moisturization. If you have oily skin, you might find creams too heavy for daytime use, but they could work beautifully at night. Ointments and balms are the heaviest, most occlusive options. They're primarily oil-based and create a strong protective barrier. These are best for extremely dry skin, damaged skin barriers, or specific areas that need extra protection, like lips or hands. Most people don't use these on their face except in cases of severe dryness or barrier damage. Now, how do you choose what's right for you? Start by honestly assessing your skin's current state. How does your skin feel throughout the day? Does it feel tight, especially after cleansing? Does it look flaky or rough? If so, your skin is likely dry and needs a richer moisturizer with more emollients and occlusives. Does your skin feel oily, especially by midday? Does it look shiny? If so, you might assume you don't need moisturizer, but that's often incorrect. Many people with oily skin are actually dehydrated, lacking water, not oil. Their skin produces excess oil trying to compensate for the lack of moisture. These skin types often benefit from lightweight, hydrating gel or lotion moisturizers. Does your skin feel different in different areas? Perhaps oily in your T-zone but dry on your cheeks? This is combination skin, and you have two options. Use one balanced moisturizer everywhere, or use different moisturizers in different zones. Most people find that one well-chosen moisturizer works fine for their entire face, but you can customize if needed. Consider your climate and environment. If you live somewhere hot and humid, lighter moisturizers usually work better. If you live somewhere cold and dry, or if you spend time in air-conditioned or heated spaces, you'll likely need richer moisturization. Your moisturizer needs might change with the seasons. Lighter in summer, richer in winter. Think about when you'll be using the moisturizer. Morning moisturizers are often lighter because they need to sit well under sunscreen and makeup. Evening moisturizers can be richer because you don't need to worry about how they layer with other products or how they look. Some people use the same moisturizer morning and night, while others prefer different formulas. There's no wrong approach, just what works for you. Consider any specific skin concerns you're addressing. If you're dealing with acne, look for non-comedogenic moisturizers that won't clog pores. If you have sensitive or reactive skin, look for fragrance-free, minimal ingredient formulas. If you're concerned about aging, you might want a moisturizer with added antioxidants or peptides. Now let's talk about how to actually test if a moisturizer is working for you. When you try a new moisturizer, give it at least a week or two before deciding if it's right. Your skin needs time to adjust and respond. After applying the moisturizer, notice how your skin feels immediately. Does the moisturizer absorb comfortably, or does it sit on top of your skin feeling greasy? Does it sting or burn? Any stinging or burning is a red flag. That's not normal adjustment, that's irritation. Check how your skin feels an hour after application. Is it still comfortable, or does it feel tight again? If it feels tight quickly, the moisturizer isn't providing enough hydration or barrier protection for your needs. Notice how your skin feels at the end of the day. If you're constantly wanting to reapply moisturizer because your skin feels uncomfortable, the formula isn't right for you. If you applied it in the morning and your skin still feels comfortable in the afternoon, that's a good sign. Look at your skin in the mirror after a few days of consistent use. Does it look healthy and balanced, or does it look more congested, oily, or irritated? Your skin will tell you clearly if a product isn't working. Pay attention to and welcome and breathe deeply with me. Let yourself relax completely. Today we're going to explore oil cleansing, a method that might sound counterintuitive at first, especially if you have oily skin, but that can transform your cleansing routine. The idea of washing your face with oil might seem strange. We're taught from a young age that oil causes problems, clogs pores, causes breakouts, makes skin greasy. So washing with oil sounds backwards. But there's ancient wisdom and modern science behind this method, and understanding it might change how you think about cleansing forever. Let's start with a fundamental truth. Oil dissolves oil. This is basic chemistry. Oil-based substances on your skin, sebum, sunscreen, makeup, environmental pollutants, dissolve readily in oil. They resist water-based cleansers but surrender to oil. This is why oil cleansing is so extraordinarily effective at removing stubborn buildup. Your skin produces its own oil, sebum, for very good reasons. Sebum protects, moisturizes, and maintains your skin's acid mantle. It's not your enemy. Problems arise not from having oil, but from having the wrong balance of oil, from oil mixing with dead cells and debris, or from trying to strip oil away too aggressively. When you use harsh, stripping cleansers to remove oil, your skin often responds by producing even more oil to compensate. This creates a vicious cycle. Strip the oil, skin produces more, you strip again, skin produces even more. You're fighting against your skin's natural wisdom. Oil cleansing works differently. It gently dissolves excess oil and impurities without stripping your skin's protective barrier. Your skin doesn't need to panic and overproduce oil because it hasn't been stripped bare. Over time, this can actually help normalize oil production. Now let's talk about different approaches to oil cleansing. There are two main methods: pure oil cleansing and emulsifying oil cleanser use. Both are valid, but they work differently and suit different needs. Pure oil cleansing uses single oils or oil blends without any emulsifiers or surfactants. You massage the oil into your skin, let it dissolve impurities, then remove it using a warm, damp cloth. This is the traditional method, simple, natural, and effective. Popular oils for this method include jojoba oil, which is actually a wax ester that closely mimics human sebum, grapeseed oil, lightweight and suitable for oily skin, sweet almond oil, gentle and nourishing, sunflower oil, affordable and effective, and argan oil, rich in beneficial nutrients. The process is simple. Massage a small amount of oil onto dry skin for 1-2 minutes. Let it sit briefly to dissolve everything. Then place a warm, damp washcloth over your face for 30 seconds to steam and soften. and gently wipe away the oil. Rinse the cloth and repeat until all oil is removed. This method is natural, affordable, and allows you to customize your oil choice precisely. However, it requires more time and effort, can occasionally leave some residue if not removed thoroughly, and some people find the cloth removal step inconvenient. Emulsifying oil cleansers are commercial products specifically formulated for facial cleansing. They contain oils plus emulsifiers that allow the oil to mix with water and rinse away cleanly. These are the cleansing oils and balms we discussed in the double cleansing section. With these products, you massage the oil onto dry skin, add water to emulsify, turning the oil milky, then rinse thoroughly. No cloth needed, no residue, just clean, soft skin. Emulsifying oil cleansers are more convenient. Rinse away completely and typically remove waterproof makeup and sunscreen more easily. However, they're more expensive than pure oils, may contain additional ingredients that some people prefer to avoid, and offer less customization. Both methods work beautifully. Choose based on your preferences, time availability, and skin needs. Let's address oil cleansing for different skin types, because this is where the method's versatility really shines. For oily skin, yes, oil cleansing can work wonderfully for oily skin. It seems illogical, but many people with oily skin find that oil cleansing helps balance their natural oil production better than stripping cleansers ever did. Choose lighter oils like jojoba, grapeseed, or hemp seed oil. These won't feel heavy or potentially clog pores. Or opt for an emulsifying oil cleanser, specifically labeled for oily skin. The key is thorough removal. Make sure you rinse or wipe away all the oil. Some people with oily skin prefer to follow their oil cleanse with a gentle water-based cleanser, double cleansing, to ensure no residue remains. Give your skin time to adjust. In the first week or two, your skin might produce more oil as it figures out what's happening. This is temporary. After 2 to 4 weeks, many people see their oil production normalize to healthier levels. For dry skin, oil cleansing is particularly lovely for dry skin. It cleanses without stripping away precious moisture. You can choose richer oils like olive oil, avocado oil, or argan oil that provide extra nourishment. After oil cleansing, your skin will feel clean but soft and conditioned, never tight or uncomfortable. This is exactly what dry skin needs. Gentle cleansing that preserves the skin barrier. You might not even need a second cleanse. Some people with very dry skin find that oil cleansing alone is sufficient in the evening, followed by just a splash of water in the morning. For combination skin, use different oils for different areas, or choose a medium weight oil like jojoba that balances both dry and oily zones. Alternatively, use an emulsifying oil cleanser designed for combination skin. Pay attention to how different areas respond and adjust accordingly. Your T-zone might need more thorough rinsing, while your cheeks might appreciate slightly less aggressive removal. For sensitive skin, oil cleansing can be excellent for sensitive skin because it doesn't involve harsh surfactants or potential irritants. Choose gentle oils like sunflower, sweet almond, or jojoba. If using pure oil cleansing, be very gentle with the cloth removal. Don't scrub or rub harshly. If using an emulsifying cleanser, choose fragrance-free, hypoallergenic formulas. Many people with rosacea or eczema find oil cleansing more comfortable than traditional cleansers because it's so gentle and non-stripping. For acne-prone skin, this is where skepticism runs highest. But oil cleansing can actually help acne-prone skin. The key is choosing non-comedogenic oils and ensuring thorough removal. Jojoba oil is ideal for acne-prone skin. It's non-comedogenic and helps balance sebum production. Grapeseed oil is another good choice. Avoid heavy oils like coconut oil, which can clog pores for some people. Oil cleansing excels at removing sunscreen and makeup thoroughly, which is crucial for preventing clogged pores. It can also help soften and loosen existing clogs, making them easier to extract, though you should never squeeze or pick. Some people with acne find that oil cleansing reduces breakouts because their skin is truly clean without being stripped and irritated. For mature skin, oil cleansing is wonderfully gentle and nourishing for mature skin. It cleanses without disturbing the delicate skin barrier that tends to be more fragile with age. Choose nourishing oils rich in antioxidants and beneficial fatty acids. Rosehip seed oil, argan oil, evening primrose oil, or marula oil. These provide gentle cleansing plus anti-aging benefits. The massage component of oil cleansing also benefits mature skin by stimulating circulation and encouraging lymphatic drainage, which can reduce puffiness and support healthy cell function. Now let's discuss technique for effective oil cleansing. Always start with dry skin. This is crucial. Oil works best when it's not diluted with water initially. Use adequate oil. Don't skimp. You need enough to create slip so you can massage without tugging your skin. Usually 1-2 teaspoons is sufficient. Massage thoroughly for at least 60 seconds. This isn't a quick swipe. Take your time. Use gentle circular motions. Feel the oil warming and thinning as it mixes with the oils on your skin. Pay attention to makeup-heavy areas. If you wear eye makeup, spend extra time gently massaging your eyelids and lash line. Oil breaks down even waterproof mascara without harsh rubbing. For pure oil cleansing, after massaging, let the oil sit on your skin for 30 to 60 seconds to fully dissolve everything. Then place a warm, not hot, damp washcloth over your face. Let it sit for 30 seconds to steam your pores gently. Gently wipe away the oil. Rinse the cloth and repeat until all oil is removed. Usually 2 to 3 wipes total. For emulsifying oil cleansers, after massaging, wet your hands and add water to your face, continuing to massage. Watch the oil turn milky as it emulsifies. Rinse thoroughly with lukewarm water. Make sure all cleanser is removed from your hairline, jawline, and neck. After oil cleansing, your skin should feel clean, soft, and comfortable. If it feels greasy, you didn't remove all the oil. Use your warm cloth again or add a gentle water base. Welcome to this gentle space. Breathe and relax. Today we're focusing on an area often neglected in skincare routines, but deserving of care and attention. Your lips. Your lips are unique. Unlike the rest of your skin, they have no oil glands. They cannot moisturize themselves. They have a much thinner outer layer, making them more vulnerable to environmental stressors, and they're constantly exposed to weather, to food and drink, to frequent movement as you speak and smile. All of this means your lips need conscious care to stay soft, comfortable, and healthy. Let's understand common lip concerns and what causes them. Dry, chapped lips are the most common complaint. Without oil glands, lips lose moisture easily. Cold, dry weather accelerates this water loss. Indoor heating further dehydrates the air and your lips. Sun exposure without protection damages the delicate lip skin. Licking your lips provides only temporary relief and actually makes dryness worse as saliva evaporates and takes more moisture with it. Certain medications, particularly those that dry mucous membranes, can affect lip hydration. Dehydration affects your entire body, including your lips. Cracked or split lips often result from severe dryness. The thin skin breaks, sometimes painfully. Angular colitis, cracking at the corners of the mouth, can result from vitamin deficiencies, yeast infections, or excessive moisture from drooling or lip licking. Peeling lips happen when dead skin cells accumulate. This is exacerbated by dryness and sun damage. The temptation to bite or pull at peeling skin usually makes the problem worse. Cold sores are caused by the herpes simplex virus. These aren't the same as chapped lips. They're fluid-filled blisters that are contagious. Cold sores require specific antiviral treatment, not just lip balm. Dark or pigmented lips can result from sun exposure, smoking, certain medications, or simply your natural coloring. Some people naturally have more pigmented lips than others. Understanding these issues helps you address them appropriately. Now let's discuss how to care for your lips effectively. The foundation of lip care is protection and moisture. A good lip balm becomes your best friend, but not all lip balms are created equal. Look for lip balms with truly moisturizing ingredients. Occlusives like petroleum jelly, beeswax, or shea butter create a protective barrier that prevents moisture loss. Humectants like hyaluronic acid or glycerin attract moisture to your lips. Emollients like plant oils, cocoa butter, or lanolin smooth and soften. The best lip balms contain a combination of all three types of ingredients. Avoid lip balms with irritating ingredients. Fragrance and flavor can be irritating, especially if your lips are already chapped. Menthol, peppermint, and eucalyptus feel cooling but can actually be irritating and drying for some people. Camphor can be irritating. Salicylic acid is sometimes included in lip products, but it can be too harsh for very chapped lips. SPF protection in lip balm is valuable. Your lips can get sunburned and are vulnerable to sun damage. If your lip balm doesn't contain SPF, consider a separate lip sunscreen, especially if you'll be outdoors for extended periods. Apply lip balm generously and frequently. Unlike face moisturizer that you apply twice daily, lips need more frequent attention. Apply whenever your lips feel dry. This might be several times throughout the day. Apply before bed so your lips can recover overnight. Apply before going outside in cold or windy weather. Don't wait until your lips are already painfully chapped. Prevention is easier than repair. Make lip balm application a habit, not an emergency response. Let's talk about what not to do, because some common habits actually worsen lip problems. Stop licking your lips. This is the most important habit to break. Saliva contains digestive enzymes that break down the delicate skin of your lips. When saliva evaporates, it takes moisture with it, leaving your lips drier than before. If you catch yourself licking your lips, reach for lip balm instead. Don't bite or pick at peeling skin. This damages healthy skin underneath and creates more peeling. If you have loose flakes, gently exfoliate as we'll discuss shortly, but don't tear at your lips. Avoid lip products that make your lips feel tingly or burny unless that sensation quickly passes. Persistent burning or stinging means the product is irritating your lips. Many people become addicted to mentholated balms because they create a sensation that feels like it's helping, but they're actually causing low-level irritation that makes you need more balm. Don't use harsh or drying lipsticks without proper base care. Some long-wearing lipsticks are very drying. If you wear these, prep your lips with treatment balm first and remove lipstick thoroughly at day's end. Now let's discuss gentle lip exfoliation, because sometimes lips need help shedding dead skin. When your lips are very dry and peeling, gentle exfoliation can help, but emphasis on gentle, aggressive scrubbing damages delicate lip skin. You can use a soft toothbrush dampened with water to very gently brush your lips in circular motions for about 30 seconds. This removes loose, dead skin without trauma. A soft, damp washcloth can serve the same purpose. Gently rub your lips in circular motions. You can make a simple lip scrub with sugar and honey or oil. The sugar provides gentle physical exfoliation, while honey or oil moisturizes. Use a tiny amount, massage very gently for 30 seconds, then rinse and apply lip balm. Some lip scrubs are available for purchase. Choose ones with fine, round, exfoliating particles rather than harsh, jagged ones. Exfoliate no more than once or twice a week and only when needed. Over-exfoliation irritates and thins the skin. Always follow exfoliation with moisturizing lip balm. If your lips are cracked or bleeding, don't exfoliate at all. Just moisturize and protect until they heal. Let's talk about intensive lip treatments for severely dry or damaged lips. Overnight lip masks or treatments provide intensive moisturizing while you sleep. These are typically very rich, occlusive formulas. You can use a specialized lip sleeping mask or simply apply a thick layer of a very emollient lip balm or even pure lanolin before bed. Petroleum jelly is an inexpensive but effective occlusive treatment. Applied generously overnight, it seals in moisture and allows lips to heal. Some people find that applying hyaluronic acid serum to damp lips, then sealing with an occlusive balm provides intense hydration. For very stubborn dryness, you might try slugging your lips, applying a thick layer of an occlusive like petroleum jelly or a rich balm over your regular lip treatment. This is especially effective overnight. Now let's discuss lipstick and lip products and how to care for your lips while using them. If you wear lipstick, prepare your lips first. Exfoliate if needed the night before for smoothest application. Apply a moisturizing lip balm, let it absorb, then apply lipstick. Choose lipsticks that contain moisturizing ingredients rather than purely matte, drying formulas. If you love matte lipsticks, accept that they're drying and compensate with extra care. Treatment before application and gentle removal afterward. Remove lipstick thoroughly at the end of the day. Use an oil-based remover or cleansing balm designed for makeup removal. Don't scrub hard. Let the remover dissolve the lipstick, then gently wipe away. After removing lipstick, cleanse your lips gently with your face cleanser, then apply treatment balm. For liquid lipsticks, which can be especially drying, moisturize lips well beforehand. Remove these carefully and thoroughly. They can leave residue that dries lips further if not fully removed. Let's address sun protection for lips specifically because this is often overlooked. Your lips are vulnerable to sun damage, which can lead to dryness, pigmentation, and in extreme cases, skin cancer. The lower lip is particularly vulnerable because it gets more sun exposure. Use a lip balm with SPF 30 or higher daily. Reapply throughout the day, especially after eating or drinking. If you'll be outdoors for extended periods, beach, hiking, skiing, use a sport lip balm designed for longer lasting protection. Wear a hat with a brim to provide shade for your face and lips. Be especially diligent about sun protection if you have fair skin. a history of cold sores, which can be triggered by sun exposure, or a history of skin cancer. Now let's discuss hydration and nutrition for lip health. Lips reflect your overall hydration status. If you're dehydrated, your lips will be too. Drink adequate water throughout the day. This supports lip health along with your entire body. Certain vitamin deficiencies can affect lip health. B vitamins, particularly B2, B3, and B12, support skin and mucous membrane health. Iron deficiency can contribute to cracked lips. Ensure you're getting adequate nutrition or consider supplementation if you have deficiencies. Omega-3 fatty acids support skin barrier function throughout your body